Hi, everybody. Derek Sloan here. I have a very special guest today, Dr. Patrick Phillips. How are you doing today, Doctor?
I'm doing great. Thanks for having me on, Derek.
So, for those of you who haven't heard of Dr. Phillips before, you may remember a special press conference I did on Parliament Hill. Dr. Byron Brattle was there. We had two other guests as well, Dr. Donald Welsh and Dr. Patrick Phillips. And Dr. Phillips is with me here today. That particular interview became the most watched CPAC press conference or CPAC video period of all time. And within about 3 weeks, it got 750,000 views. And then YouTube pulled it down. So it was censored about 3 weeks after it was released. You can still find it on the CPAC website. But within that 3 week period of time, we more than tripled the amount of views that the next highest CPAC video got from about 7 years ago. So, Patrick, did any of us involved in that have any inkling of sort of where that interview would go with Dr. Bridle and everybody else?
I was certainly surprised at the amount of views that it received. I think what happened there is that there's a huge appetite for this kind of information that was being censored left, right, and center through the mainstream media and even through big tech. But I think what happens was we slipped through the cracks because it was a CPAC uh, like YouTube channel, right? So a government YouTube channel. And all of a sudden, because it was an official thing, I think the censorship was delayed in that. And so it was allowed to catch on for much longer than other things that would often get censored as soon as they started to get that amount of views. So I think it was wonderful. I think I'm not surprised in the sense that because a lot of people were looking for this kind of information that was received there. But what was surprising was that it didn't get shut down sooner, considering the amount of censorship that happens through YouTube and other places. So it was wonderful that our message was able to get out there to a lot of people, and it definitely had a big impact. I hear about it all the time, but people who heard of me through that interview specifically, that was how they heard of who I even was. Yeah.
Yeah, no, I think it definitely provided a platform for Dr. Bridle and everybody involved in that to sort of speak to a bigger audience. And I know that after that, Dr. Bridle was on Fox News and some other things, and it really did
Mhm.
provide a platform for, COVID skepticism, as it were. And just for people that don't know exactly what we're talking about, we did on Parliament Hill when I was a member of Parliament, we did an official parliamentary press conference that was then broadcast on CPAC, which is our parliamentary broadcasting consortium. Um, we were simultaneously broadcasting on Facebook Live. That broadcast was shut down halfway through, so the censors picked that up right away. But you're right, the YouTube video was able to last for about 3 weeks, and 750,000 people saw that. And of course, it's still spoken about today as a time where it turned the light switch on for a lot of people. And I've heard that from people who are, famous in the freedom movement. I'm thinking of Corporal Bulford. You'll remember the former RCMP officer that used to be security detail for Justin Trudeau. Told me personally that that particular video really, cemented his skepticism about what was going on. We had Dr. Bridle speaking about issues with the vaccine. You were talking about early treatment issues for COVID, ivermectin, amongst others. And we had Dr. Donald Welsh talking about sort of problems with the medical censorship generally. Um, Moving on from that interview, you're actually in trouble with your College of Physicians here in Ontario. Can you tell me a little bit about what's going on with that? As I understand it, you're not even allowed to practice medicine right now.
No, they've suspended my license. Yeah, it's a bit of a long story because it's complex and is kind of built up, but the essence of it is um, I began to speak out on COVID related issues when I saw the devastating harms of patients in my community from lockdown. So there was depression, missed cancer diagnoses, or other things, depression, mental health. I was seeing that the harms of the lockdowns were outweighing the benefits, and nobody was talking about that. They were putting media blasts out by the OMA that doctors were calling for harsher lockdowns to stop the spread of COVID. I'm like, no, we had like no COVID in our community, and the devastating harms were just piling up. And so it was at that point that I decided to speak out. And shortly after that, the college started to investigate me. So they issued two physicians putting complaints or reports against me, saying that I'm spreading misinformation by talking about the harms of lockdowns and speaking out about informed consent and my concerns about the vaccines. And so that's how it started. So that was the first investigation that started against me, was based on freedom of speech issues. Then as I started to see some of the harms in the vaccine, I started to see devastating adverse events after patients were getting vaccinated. I saw them coming into my emergency department. And so by law, I was reporting those to public health. And I got a note, I believe it was at the beginning of May, from my public health officer locally, saying that he rejected every single one of my adverse events reports that I sent in. And I was really concerned about this. I sent him a note back that I faxed to him. I didn't get a reply, basically saying, why were these rejected? Like, tell me what I need to do to like, he's saying that they were incorrectly filled out or something, like there was some missing information. Because, for example, the patients don't always have their lot number or the exact data when they were vaccinated, right? So sometimes I can't fill that in perfectly, especially in an emerge department. So anyway, he used that kind of as an excuse to say, oh, well, we had to reject all of these. And I was very concerned about that. I didn't get a reply, so I went public. I did an interview with Rebel News on these vaccine adverse events that were happening, and that they were not getting reported to the system, so people weren't able to get informed consent. Anyway, the result was he retaliated and reported me to the CPSO. And the CPSO started investigating me for every single one of those adverse event reports. So every adverse event report that I sent in, not all of them, they said fails to meet the standard of practice for the profession, and I'm being prosecuted for each one of those. So there's a number of there's like 10 charges they're laying against me. That's the gist of kind of what's come against me. As a result of that, as well as treating vaccine injuries or COVID, and for which I prescribed some patients ivermectin, which was backed up by like 30 studies at the time, along with fluvoxamine as well. I got reported by there's a whole snitch culture actually on anybody who prescribes off-label medications, and so the local pharmacist reported me to the CPSO for prescribing those, and then they restricted my license from prescribing ivermectin, fluvoxamine, and atorvastatin, as well as giving any kind of vaccine exemptions, which I did write for patients as well. Like I said, it's complicated. There's a lot to all of this, but basically what happened was I followed all of those restrictions. I lost my job at the hospital, so I decided to start my own family practice, and I was following all those restrictions. But as part of those restrictions, the college reserved the right to pull any patient chart, their entire patient chart, of any patient that I saw for whatever reason. And all these patients that I picked up after that time, this is after I was already under investigation. I developed kind of a bit of a reputation from our interview. And so my patients were very much on the side of medical freedom. Many of them were vaccinated, but most of those were vaccinated by force, by coercion, and they wanted to have a doctor who respected their autonomy. And so at one point, the CPSO decided they're going to pull a bunch of patient charts. They asked for 17 patient charts. There was no complaint. There was no accusation. I had signs up that I'm not allowed to prescribe ivermectin and everything, and I never violated that. But this is just a routine request. They wanted all of those patient charts. And I spoke to my patients, a few of them, like I didn't have to feel like I needed to for all of them. And I wrote back to the CPSO, said, look, if you get consent from these patients that to have their charts, I will give them to you in a second. It's their patient's information, it's not mine. But these patients know the CPSO. They've seen what the CPSO has done over the last 2 years in removing their rights, removing informed consent. They're concerned about them knowing about their vaccination status, that it might be used against them, as it actually was by removing their doctor, right? And so I decided at that point, I wrote them a letter saying, look, this is a violation of their Section 8 Charter rights, which says that all Canadians should be protected from unreasonable search and seizure. I asked them to set up a scheme where they ask for consent from the patients, and if they get consent, I'll send them their files. Alternatively, I asked them to go to a court of law under Section 76, I believe, of I'm not 76 or 77. It's one of the 70s anyway, in which they can go to a court of law and get a warrant to get these patient files, where it can at least be challenged in a court of law, right? Because there was no investigation, there was no patient complaint, and these patients did not want their information going to the CPSO. And so I decided not to send it off to them, and as a result, they immediately suspended my license. But I knew I couldn't live with that, living with these patients, sending it to a hostile organization that's hostile to their basic human charter rights, and rights to patient privacy. And so that's how I lost my license. Anyway, there's a long story. There's more details in between, but that's kind of the gist of what happened. Yeah.
Well, I'm just going to pick up on a few interesting points here that you mentioned. You did mention that you were prevented from prescribing fluvoxamine. Fluvoxamine
Yeah.
is a drug that is, typically known as an antidepressant, but it's been useful for preventing and treating COVID. In fact, so useful that the Ontario Science Table, which is sort of the government arm of COVID treatment, they even say that it's okay to use, and they
Yes.
rely on a study that came out October 27th, and that was October 27th, 2021, which was almost a month to the day, I believe, that you were prevented from prescribing fluvoxamine. So
Yeah.
not even a month after you were prevented from providing fluvoxamine, a study comes out and says, okay, yes, you can provide it. And of course, now did the CPSO come and apologize to you and take off that restriction when that study came out?
No, no, they doubled down. Yeah, they did not acknowledge that whatsoever. Um, what's and it revealed some. It was very revealing, right? When that happened, because we asked for that to be removed, and they refused. And what's more concerning about that is not about me, right? About me being restricted. It was a restriction on my patients. Like, my patients were not able to access fluvoxamine, right? Which is then recommended by the science table. Not that I would trust, honestly, anything coming out of the Ontario Science Table. Um, I I was horrified, and that was part of what led to me speaking with you, right, about ivermectin. That was one of the main things that I talked about in that press conference. When I saw at that point, I think it was in June, there were at least 30 studies worldwide on ivermectin. Not all of them necessarily positive, but overwhelmingly, when you aggregate them, it was like a 70% reduction in mortality. And And so I could not understand why this was not being widely prescribed, especially because it's been administered billions of times across the world, because it's used in the third world to treat parasitic infections, and it's over the counter in most countries of the world. It's actually over the counter in Canada. I have a big bottle of it in my bedroom. There's a medicine cabinet there. I use it for my pigs. Use it to deworm my pigs every week, and you can buy a bottle of it that would give you like at least 100 human doses for about $100, so $1 a dose, right? And um, that just goes to show how safe it is. They don't make things over the counter if they're not safe, and there's almost no adverse events. There's no deaths attributed to ivermectin. Um, it's just it's safer than Tylenol. There's so many people that die every year from Tylenol, from Advil, which causes GI bleeds, it causes brain bleeds, it causes kidney failure, right? And so it's way safer than those drugs. So it's insane that it's not over the counter for humans as well. But anyway, what I was shocked by was I looked at the Ontario science table that said ivermectin was not recommended, and what I looked at um, was kind of shocking at that time because, like I said, there were 30 studies out at that time, and they picked I think it was between 3 and 6. I'm pretty sure it was 6 studies that they looked at. They cherry picked the only ones out of those 30 that showed either equivocal or negative results, and then made a conclusion: ivermectin is not recommended. And like, what about the other 24 studies? They didn't even look at those. And I looked at it for other things as well. Like they cherry picked studies out of the aggregates that you can find on PubMed. Anybody can look these up. You can just look them up. I mean, it's a bit of a process to search PubMed, but there's aggregates online as well. They just cherry picked the studies, and I saw that they did that time and again for all their treatment decisions. They were politically based, um, and uh, and not to be trusted, in my opinion. I wouldn't trust a thing coming out of the Ontario Science Table. But so that was why I was even more surprised when it came to fluvoxamine. I was banned from prescribing fluvoxamine for patients when it was already in the studies, and then the Ontario Science Table that I don't even think has anything to do with science. I don't trust their opinion, like I said, on anything. Even they recommended fluvoxamine, and they would not take that restriction away from me. So that shows it has nothing to do with science. It's about obedience. They want doctors who do what they're told without question, and will go against what the science says, will go against medical ethics as long as you comply with the will of the CPSO. And that's how they determine who gets restrictions. That's how they determine who gets suspended. It has very little to do with patient safety and very little to do with science.
Well, you know what? Those are. I think that's a great word to end on. And I just want to thank you for sharing your story today. And I want to encourage everybody here to support Patrick, who's in the middle of a fight right now with the CPSO. There was a hearing just a few days ago. We want to support Patrick. He hasn't been able to work now for how many months have you been unable to practice medicine?
It's been 6 months at this point.
Okay.
Yeah.
We want to support Patrick, help him pay for his legal fees. Patrick, thank you so much for being here today. We're going to do a second interview at some point soon where we discuss medical freedom and censorship here in this country. So thank you so much for being here today, and we'll talk to you soon.
Thank you so much, Derek. Thank you for your support.